Hello there, Wicked Mike here. Welcome to another episode of Hard Driving. This episode was suggested by Joe from Troy, Ohio. Thanks for watching. He wanted to hear my commentary on the Affordable Health Care Act, more affectionately known as Obamacare. Well, here's how I feel about it. In a perfect world, I think that maybe it wouldn't be such a bad thing. But I also believe that, believe it or not, that in a perfect world, I think communism wouldn't necessarily be a bad thing. But it will never be a perfect world. And as long as someone's running it, or a group of someone's that has their own agenda, then you're always going to have something. It's always going to there's always going to be an issue. With that being said, why I don't think that it's necessarily the best idea. First of all, let me just say this: I do believe that our healthcare system, regardless of whatever someone comes up with, at this point in time is a joke, for lack of a better term. However, I don't necessarily think that Obamacare is the answer to the question. I believe that we have seen a few success stories with it. However, I've not seen any bad things with it when it comes to healthcare. However, I do believe it could definitely be a slippery slope. Whenever you have the government running anything, first of all, there's the old adage: a government that's big enough to give you everything is also big enough to take it away. Not only that, I also believe, and I know this is going to sound crazy, but that's all right. I don't really care. That if you have somebody with a terminal illness, cancer per se, and they have, the doctor says, well, you have 6 months to live if we do chemotherapy. I often wonder if the government, if they're going to have their hands in this, if down the line they're going to say, well, if you're not going to live, we're not going to fund your chemotherapy or whatever. And it does make me a little bit nervous. The other thing is there's you have to have it, or you have to have health insurance. Now, or you get penalized. If you don't have health insurance, then you have to have Obamacare, and not everybody wants it. I mean, at the end of the day, I'm sure that there's going to be a lot of people waiting around in waiting rooms for waiting for doctors that aren't getting paid. And the thing of it is a lot of people are like, well, doctors, they make a lot of money. Well, you'd want to make a lot of money too if you had a $150,000 or whatever, or more loan to pay back. You don't just get college for free. I don't know too many people that do. I mean, I'm sure there are a few doctors that have gotten a full ride, but I don't think there's as many as not. So, it just seems like a real slippery slope. And for something that has, I don't know, it's like a 5-inch thick booklet of ins and outs of the Affordable Health Care Act, why does there have to be so much to it? Why can't it be cut and dry? The other thing is if it's so good, is the president and Congress using it? Are they getting better health care? Do I think that Affordable Health Care Act is a good idea? Again, in a perfect world, I think it is. In our current world, our current country standing, no, I don't. We're so many $1 trillion in debt, and then we're going to go ahead and take on health care for not only, not only people that don't have jobs, but we're going to force people that aren't getting paid enough to take it. Not everybody can afford it. But even if they don't take it, they still get penalized for it. Lastly, not everybody wants insurance. Some people have the money to just pay it out of their pocket. So how fair is that? So, which I don't think it's fair at all, obviously. So with that being said, that's my take on it. If you agree or disagree, let me know. Check me out on Facebook. You can check me out on Facebook, Hard Driving, Wicked Mike. Check me out on email, wickedmikehd@gmail.com, or you can just leave a comment right here on YouTube. Thank you, and have a great day. See you on the flip.
This has been Hard Driving with your host, Wicked Mike.